If I could move on now to Dr. James Haddock, who joins us down the line and is on the front line of this in an NHS hospital. Can I ask you firstly, if you were able to hear the Health Minister there, whether you were reassured by what she said on things like protective equipment for staff on the NHS, ventilators, that type of thing?
Yeah, good evening, Nick. It's good to see that the government are stepping up their activity and stepping up measures. However, the conversation you had earlier with the Health Minister, Helen, I wasn't completely reassured by that. I felt there was a lack of detail, particularly about how we're going to procure ventilators. But more importantly and more pressing right now, we are hearing reports from colleagues that there is a severe lack of PPE, particularly masks.
This is personal protective equipment
on the front line. Personal protective equipment that we use prophylactically to protect ourselves from viral transmission, but also that has a secondary effect in that healthcare workers are less likely to transfer the virus to vulnerable patients in hospital who don't have it.
Is there anything you can do to mitigate that? I mean, how are you coping with that situation?
Well, it's early days at the moment. I am worried. I wouldn't like to say any specifics, but I am worried that some doctors and healthcare workers are being put in positions where they're not using PPE appropriately. And if that is happening, I think the Department of Health need to act urgently and ensure that PPE is getting to hospitals.
We've heard there have been suggestions of bringing in people who might have recently retired, of bringing in volunteers. Do you see any sign of that yet on wards, of additional people being available to help with the load?
I'm not aware yet of staff locally back in work, but I am aware that there are colleagues who have volunteered and are keen to get back in. I think, again, we're waiting on the detail. A lot of these retirees will need to be fully protected. They need to be re-registered and they need to be indemnified to come back to work.
All right, thank you very much for that.